Are prawns safe to eat during pregnancy?
Pineapple has a protein which is known as bromelain, which in high concentration can lead to miscarriages and all.
Doctor, is it safe to consume alcohol during pregnancy?
Alcohol consumption leads to early delivery. Abnormal baby can be formed, which is known as fetal alcohol syndrome. Sometimes the baby dies inside the womb.
It's essential to make right food choices during pregnancy, and to guide us through this we have Dr. Parul Sathe with us, an obstetrician and gynecologist at Cloud9 Hospital, Nerul, Navi Mumbai. She will be sharing her insights on today's topic, pregnancy diet foods to avoid when you are expecting. So let's start. Welcome Dr. Parul.
Thanks Radhika, thanks for welcoming me here.
So doctor, what type of fish should be avoided during pregnancy?
Oh, good question. Most of the women nowadays ask this question, we are so fond of fish, all of us know they are rich in protein, they are very good for baby's brain development, baby's eye development. But we should be careful while using fish. There are two types of fish. Some of them have high mercury content, which are not good for us because it can lead to mercury poisoning in baby. Okay, so we should avoid eating surmai, king mackerel, our favorite. Rather, we should focus on salmons, sardines, mackerels and anchovies. They have low mercury content and 2 to 3 servings of this fish can be taken during pregnancy.
Are prawns safe to eat during pregnancy?
Yes, prawns mercury level is low and they are very good source of protein, should be taken safely during pregnancy.
That's great. Should an expectant mom avoid eating pineapple, papaya or raw mango during pregnancy?
Yes, very frequently asked question. So pineapple, 1 or 2 slices of pineapple is okay. It has been seen that pineapple has a protein which is known as bromelain, which in high concentration can lead to miscarriages and all. So how much do you eat? 1 full pineapple? 2 full pineapples? No, 1 to 2 slices is okay. Papaya has latex and papain. Raw papaya should be avoided in pregnancy. A ripe papaya can be taken. It does not lead to any miscarriages. And mango is good in pregnancy. It has all the micronutrients. It has vitamin A, it has vitamin C. Rather, it is good for a pregnant woman and should be taken during pregnancy.
Okay, so doctor, should an expectant mom avoid unpasteurized dairy product during pregnancy?
Totally. Unpasteurized dairy products should not be taken during pregnancy because it can lead to infections, listeriosis, salmonellosis. Due to listeria, in fact, it has been seen that babies formed can be abnormal. It can lead to miscarriages and stillbirths. Any infection for that matter will lead to loose motions, fever, discomfort to mother, and hence it may affect the baby as well. So whenever we are consuming dairy products, it has to be pasteurized properly, it has to be stored properly and consumed.
So doctor, are raw or undercooked eggs safe to eat during pregnancy?
Not at all. See, the main point is whatever you are eating during pregnancy should be cooked properly. Be it fish, be it prawn, be it milk, be it eggs. If we take raw eggs, there are high chances of getting salmonellosis, which leads to infection. Infection means there can be fever, pain in abdomen, loose motions, which may lead to miscarriage, which may lead to preterm labor, which may lead to discomfort to mother, dehydration, and hence affect the baby.
That's important. Should an expectant mom avoid caffeine during pregnancy?
First of all, let's see what is caffeine. So we have a notion that caffeine is in coffee, coffee matlab caffeine. So it's not like that. Caffeine is in coffee, caffeine is in tea, caffeine is in chocolate, caffeine is in some drinks as well, right? So we should know that 200 grams of caffeine during pregnancy per day is okay. That means 1 cup of coffee only. Okay, so if you want more coffee during pregnancy, please take decaffeinated coffee. So caffeine content goes low if you want 2 cups. If you want tea, 2 cups of tea can be consumed safely during pregnancy. Chocolate, 1 small piece, that's it. Okay, other drinks, soda and all we should avoid. So there is an upper limit how much caffeine can be consumed during pregnancy, because this caffeine, if goes to baby, cannot be metabolized by the baby. It will accumulate inside the baby. Then it will lead to problems in the baby as well. Okay, so we should avoid taking excessive caffeine during pregnancy.
Doctor, is it safe to consume alcohol during pregnancy?
No amount of alcohol is allowed when you are pregnant. Okay, If you are consuming alcohol and you have conceived, if you come to know that, array, I was taking lots of drinks, oh, I am pregnant, so you please meet your healthcare provider immediately. If you are consuming lots of alcohol when your baby is being formed, that is in the first 3 months, then it affects baby's formation. Abnormal baby can be formed, which is known as fetal alcohol syndrome. Okay, so baby's eyes, baby's nose, baby will be deformed, and baby's brain will also be affected. So alcohol should not be consumed in pregnancy. First 3 months are most dangerous. After that also, if you are consuming alcohol, this will go to your baby, right? And your baby's liver is not yet developed to metabolize the alcohol, to get rid of it. It will accumulate inside the baby again, and it will lead to problems. It has been seen that alcohol consumption leads to early delivery. Sometimes the baby dies inside the womb. Okay, so we should avoid taking alcohol during pregnancy.
That's important. So doctor, lastly, are foods containing artificial sweeteners safe during pregnancy?
Artificial sweeteners are of various types. So stevia, which is a natural one, can be taken during pregnancy. Then there is aspartame, which is in yogurt and all. It can be taken in desserts also. They put aspartame very frequently nowadays. So it can be taken during pregnancy. Sucralose in fact can also be taken, but saccharin should be avoided during pregnancy because it is passed to the baby. And again, baby cannot metabolize. So it will get accumulated inside the baby. So we have to be choosy. Artificial sweetener is not of one type. They are of various types. So what we can take is stevia, we can take is sucralose, and we can take is aspartame. That's it. Okay. For that matter, that's why what we do is, I personally tell patients to avoid eating excessive sweets. We keep a track on their sugars throughout pregnancy. We do some tests very frequently so that we keep a check. If the sugars are on higher side, first advice which we give is diet control and to avoid eating sugars. But suddenly, cutting down the sugar is very difficult for them. Then we advise these safer versions to them in limited amounts.
Thank you, Dr. Parul, for guiding and providing your expertise on such an important topic, which will surely gonna help expecting moms to make healthier choices.
Thank you, Radhika. I hope this talk is useful for the expecting moms out there.
Thank you so much. If you found this episode helpful, do share it with others and subscribe to our channel for more such informative episodes. Until then, take care and stay healthy.